Hello, I am Oluwatoyin Adewumi. I'm the Executive Director of Campbell Foundation, also known as Campbell Care Foundation here in Nigeria. We're here as part of the full swing of activities for Breast Cancer Awareness Month, October, month pink, but also the month where we amplify and show the need for early detection and to sound the alarm and herald the need to advance the cure for cancer. So our foundation is here at LUTH Cancer Center. This is a relationship that has been ongoing for almost 3 years. Our flagship program, the beautiful, bold and strong, aka Project BBS, was launched here in 2023, and essentially we give beauty kits to patients, female, undergoing active cancer treatment. The sole aim being that you don't have to look like what you're going through. Today we launched our food and nutrition assistance program. If you're going through active cancer treatment, you need good food, you need nutrition. All these programs were curated for the foundation because I was once a recipient of such in the United States. So look good, feel better, and through the Early Fund, I received gift certificates to go to Stop and Shop for nutrition assistance. So this is our way of giving back. This is our way of helping cancer patients through the survivorship journey. My heart is full. I am happy. I am glad I had the chance to speak with warriors going through treatment, and I hope that we were able to touch their hearts today. Thank you. In Nigeria, to push the boundaries of finding a cure, advancing research. But I believe in starting with the lowest hanging fruits. And I also believe that cancer care is not just the active treatment part. The psychosocial services, it affects your mental health, it affects your finances. If I don't have insurance, cancer care in America is $800,000 minimum. And I'll use myself as an example. I had a recurrence in March. The cancer came back, hit my liver, hit my chest, hit my spine, hit my skull. And they tried the treatment before. It didn't work. It's like the cancer had gotten smarter. So they've been trying different things. Yeah. So we finally found something that worked, which is what I'm taking now. And probably some integrated therapies, rest, and stuff. So it's been practical. It's been a journey. And so when I'm going through mine, I'm thinking, how will people back home going through the burden, how do they do it? How do they cope? You know? Prior to coming, I had participated in a conference of Global Health Catalyst. We had, health ministers, doctors, oncologists, radio oncologists who were there, and they were all saying the same thing. In low and medium income countries, cancer is starting to become a burden. So it's not just AIDS and what is it again that we always focus on, AIDS and malaria. We can't just do AIDS and malaria anymore. We need to look at cancer, but then cancer is not something that the government alone can do. So we need government, we need the politicians, we need scientists, we need the doctors, and we need advocates. So don't think that, what you're doing is nothing. Trust me, you're helping. Like, you are helping. It took a one-woman mopole, I don't remember her name. Like, she had all the politicians in the days of Nixon under her finger. She was going from office to office, knocking on doors. Like, we need to do something about cancer. Her husband had cancer. If I remember her name, and she pushed and pushed and pushed and pushed. And today we have a comprehensive bill for cancer care in the US. So, whatever little work that we can do as a foundation, we'll continue to do. And trust God to, to help let the fruits of our labor bud. So the nutrition assistance program is to help, because I know that things are expensive in Nigeria. Food is expensive. And Yoruba, they say if hunger comes for poverty don't, at least a good chunk of it has been taken care of, So my hope is that this will help. And we would love feedback from you, feedback from the patients, The other thing was, okay, how do we add protein? I was speaking to a hematologist, actually, so one of my in-laws, and she said, do dry protein. You can add milk to it. You can do things like that if you really want to put protein. So we'll look at it with what your feedback, will be much appreciated, so that we can work the kinks and make sure that things
especially your meditation part of it. Patients are very confused, This one will come and say, somebody told me that I must not eat everything. What should I eat? What should I? Even if you tell them today, they'll still go to Google, Dr. Google.
Dr. Google, yeah.
Dr. Google said, I must not touch anything protein. I must not touch anything sugar. I must not eat anything only chemo.
Yeah.
I must not eat meat. No fish.
That's not true.
No.
You better eat protein.
Yeah. So it's a problem. I really thank God that you are here. You're gonna tell us and help us. What should they eat? What should they
not eat? Yes.
It's very important.
Yes.
Because they're confused. They are saying they say sugar is bringing cancer. Sugar is feeding cancer. Meat is feeding cancer. So what should we do? We need somebody. Sometimes you can even come and then educate them.
Definitely.
Just give a lecture as they're sitting there receiving their chemo. What to eat, what not to eat. Lifestyle. It's very important. But this will help a lot. We are so grateful. Again, thank you.
Thank you, Mom.
Give it up, please. We will.
Yeah.
God helping us. You stop bringing the makeup.
No, because part of what happened, the change in administration caused uncertainty.
Yeah.
Funding issues. Nobody knew what to do. Nobody knew what they were doing. And then because of my health issues, so it was like, okay. But then I'm like, let's start 2026 in October and just relaunch. So we're like, I know, but for us, we have started. It's a new year, so so October. Let's ride 2025 into 2026 strong. So we're definitely you're going to be seeing the volunteers. You're going to be seeing Mrs. Olopade.
Yeah.
You're going to be seeing her.
Yeah, thank you so much. And we've got such wonderful people.
Thank you.
These are busy. We say I'll give them
Thank you.
Thank you so much.
Thank you.
Yeah.
Thank you. Appreciate it.
Okay.
Yes.
Hope you don't forget, I'm Michelle.
Yes, I won't forget that. That's why you will.
All right. Thank you.
Thank you. So the patients, what time they usually?
Yes. Okay. It depends. They can start from now and until the end of the day. Let's have 2, 3. Yeah. But this is just for new patient.
Yes.
The naive one. Those who are just going to start today. Yeah.
Yes.
The remaining I'll keep in the store.
Okay.
I'll give tomorrow. I'll give on Friday for those who are just new.
Okay. Beautiful. So whatever we give you, will last you like a week, and then we can come back. Perfect. Good. That works. And then so she'll bring another batch. So if you let us know, she'll bring another batch. We'll do it like that.
We'll keep in touch all the time.
We will. You hear more.
You're so beautiful.
Thank you. Thank you.
I can't hear
Appreciate it.
Thank you so much. Yeah, so when are you going back?
So tomorrow, Ibadan, we are having an awareness campaign at one of the markets.
Wow.
And then in 2 days, we are having another awareness campaign in my hometown. And then I come back to Lagos.
We just gave in a mission.
That was it. Let's get things done. So come back and then have a fireside chat with the Chief Operating Officer of St. Cyril's Cancer Center, just to talk about what it is to live with cancer. And let people know there's hope. It shouldn't have to be a death sentence. Hope. Early detection does save life if you could detect it early. So that's what we're here to sort of amplify and let people know that, there are people living with it and they're living their lives. I mean, here I am, I'm traveling.
Yes.
People are like, hey, you traveled? Hey, how? I'm like, yes. People with high blood pressure travel, don't they? Yes. So I'm not travel.
Yes.
As long as I'm comfortable,
Yeah.
So the key thing is, I make sure that I make myself comfortable, hydrate, eat well, rest. That's critical. And then the rest is easy.
Yes.
Thank you.
Nothing to say. You said it all.
That's it.
Yeah.
Thank you so much.
Thank you so much again.
Thank you.
That was nice meeting you.
Yes,
today.
I know, in the flesh. I was there in January, but I didn't get to meet you, so.
I was on leave. Oh, you've been here?
Yes, you are.
Yes.
Yeah.
Okay.
So
That's good.
I did meet Dr. Echo, but thank you for the opportunity.
Yeah.
Thank you.
Thank you so much.
Thank you.
Thank you, everyone. So you are staying with me, or you're also going? Yeah. Thank you so much. We're gonna take pictures.
Sure.
To every patient. When we give the gift and we take pictures, we will send it to you.
Okay. Thank you. I appreciate it.
We'll have them today, tomorrow. Today is Tuesday.
Yeah, that's
Yes,
fine.
till Friday.
Yeah, that's fine. That's fine. We'll take it.
So
Thank you.
the day has started.
Yes, it has. Hello, ma. Can I give you a hug? Are you here for chemo too? No.
Done chemo over time.
Huh?
Barely a year now.
Okay, so you're a
over
survivor?
it. Yes, I'm a survivor. I heard you say you have a husband, you have a...
Yes.
I lost husband. Cancer now came again, but I'm a survivor. That's why I'm just survivor. Don't like it, but if you don't mind.
Oh, no. I want to hear your story.
Very good and wonderful one. Just by his grace.
Yes.
By his love.
Yes.
Chemo, surgery and all that.
Yeah.
I'm here.
I did chemo, I did radiation, I did surgery.
I've not done radiation, but I'm here to say that I've survived.
Good. I'm happy for
14
you.
sections of chemo.
Wow.
I did the first 12. I started the treatment 2nd of January 2024. As a matter of fact, I lost the person that came to introduce me here. She died 31st after 6 sections of chemo. She was diabetic and had complications. When I told them here, they were marveled at what happened. What could have caused that death? But thank God, I now went through the whole process for 12 sessions. Then had a post one after surgery. That was in February 8th. And it was divine intervention and provision as well. 2.8 million. That was what was donated to me by my church.
Wow.
To go for this surgery. So I'm standing here to say that I had support. And I'm an encouragement to a lot of people that are still thinking of how to go about it. Mine was divine guidance. Stage 3 cancer.
Yeah.
Since 2023.
And you're
I
still
started
here.
the treatment 2nd January 2024.
Beautiful.
I'm here to say that I'm getting better. Today I weigh 60 kg, but by the time I started chemo, I was weighing from 70 kg to 48. I laid down and said, Father, this reduction, this emaciation must end. I was bony. But someone saw me this morning and said, you're looking beautiful on your dress. I said,
Sorry, can I have this? Mike.
I am okay.
Just hold it.
Okay, what I'm trying to say is that by His grace, mercy, and love, I'm a survivor of cancer, breast cancer stage 3, that was diagnosed since 2022 in Enugu, because I have a sister, nurse, and my family have been very supportive. God now did it again when I wanted to do the surgery. It was not planned. I didn't have any money in my account. I talked to my family my church. Within 1 week, 2.8 million was donated for me. It was used to support me to go for my surgery. I'm just saying this to encourage a lot of people that may be passing through this situation. And the problem is not even this case, it is the fear that we put in us that you will die of it. I had a lot of messages. People called me, but I don't know. I surrounded myself with a lot of supportive men and women that said this lady should not die. The person that I lost that is of pain to me till tomorrow, the husband is still alive, the 2 boys are still alive. So when she passed on, I had a voice that said, you continue your chemo, because she had already done the 6 to 1, planning for surgery. All of a sudden, I continued. That was, I did like 3 then, but as I got on the whole situation, I continued, did the 12th, had the surgery on 8th of February. The 7th of February, that I will never forget. By 3 weeks, I was up on my feet. I didn't even know I had staple in my body. I was called by the hospital that I should come and remove staple. I said, how? Where? I thought of the pain, but when I got there, they were like, just lie down. I had back, and I was up. By His grace, I'm this very active person. God has helped me. If I tell anybody I'll be 50 by next year, they'll be looking at me that, what happened? How have you been doing it? So it's just for us to know that everything is possible to him that believes. I just trusted God. I held on to Him. Then I was following direction, guidance, medically. Okay? Then nutrition is good as well.
Yes.
Nutrition is good. Then if God helps you, you have finance, you have the support, you have the funding. You go through it and come out better. Bible says refined like gold. That was what Job said. That when He has tested us, when He has tested you, when He has tested me, we will come out refined like gold. And that is why I'm here. Thank you.
Thank you. Thank you. Thank you. I really need to hug you again, ma, because this for me is you've given me reason to continue the work.
Two husbands, 2 children. But there's God,
Yes.
who can do all things.
Oh yeah, and trust me, if you want a husband, He will give you a husband. Yes, and that's what I tell, that's what I tell those who have been newly diagnosed in the US, because so our foundation does advocacy work there in the United States, and then we do the patient support services and whatnot here. And one of the things I tell people is, at the end of the day, you have to choose to live. I was diagnosed with breast cancer the same day that I was supposed to open my restaurant. So imagine you've sunk over almost $80,000, gotten equipment, you are ready to start your business, and then your doctor, your OBGYN calls you and tells you, Tony, I'm sorry, you have an aggressive form of cancer, stage 3B, that had metastasized to the lymph nodes. So you now ask yourself, please come and welcome. So you ask yourself, yes, have a seat. So you ask yourself, do you want to live or do you want to give up? Exactly. So you cannot give up. One of the things that my doctor told me, I did not even have any symptoms, but it's important for you to be breast aware. Even if, please, mommies, tell your daughters, tell your children, let them know their bodies. Let them know their bodies. It's okay. Let them know. If you see any discoloration, if you see anything, it's important, because if you catch it early, then it can be treated early and it's less expensive. Now, I didn't, but then the way the cancer was developing, there was no lump per se. By the time I discovered the lump, I was actually taking a shower, and it was very tiny. So I called my doctor and I said, I think I noticed a lump. And then when I went to her and she did the breast exam, even when she did it, she was very quick about it, and I said no. So when she did the exam and she did it too quickly, she said, I don't feel anything. And I told her, I said, use the tip of your forefinger and just run it gently on my nipple area. That's what I told her. And then when she now did it, she now felt it. I now had to go for a bilateral mammogram and ultrasound. After the ultrasound, the radiologist came in and the first question he asked me was, Tony, do you have a history of breast cancer in your family? I said, no. He said, because what I'm seeing is not good. Your right breast looks like the breast of an 80-year-old woman. It's dead. It's necrotic. That's what he said. The cells were already dying. How? It was like the oxygen left the room. I called my mother. My mom is, I called her, and the first thing my mother told me that I've always held on to, she said it in Yoruba. She said, don't die before death comes. Let your doctor, let them decide, and then we move on from there. And so treatment started. And of course, I'm a woman of faith. I'm a pastor's wife. I'm a pastor myself. I'm a woman in ministry. And I believe that all healing is supernatural because God has given the doctors knowledge. So, started chemotherapy, finished chemotherapy, did surgery. They had to take the whole breast out. There was nothing to spare. I mean, now, technology has, like, breast cancer technology has a thing. There's nipple sparing, mastectomy, all kinds of things. My own time, 8 years ago, they chunked everything out, left skin. And then, because I wanted things to be even, they put a tissue expander there. So the tissue expander was in place, and then I went for radiation. So after radiation, so what? Chemo, surgery, tissue expander, 5-hour surgery. So the first 3 hours was to remove the breast. The next 2 hours was to push the muscles away from the sternum and put it. And then every week I had to go in. They were pumping saline so that it's all nice and even. And then after that I rested, and then I went for radiation. And then I waited 6 months, and then they now took the expander out. They now put the implants. So I understand what you're going through. I understand your journey. But here's what I will say. We just had a lady share her story. Surround yourself with people that love you. If you know how to pray, pray. Prayer works. Read your Bible. Read your Quran. It works. See, it works. Speak to your body. The Bible says life and death.
Yes.
Life and death. So speak life to your body every day. If I didn't tell you that I have breast cancer, would you know? I speak life to my body every day. I have 2 beautiful children that I'm living for, and I tell people, I say they're in university now. I say the next 10 years by God's grace, I have wedding and graduation to plan. And yes, I speak it. I let people know. I have wedding and graduation to plan. No, I'm not going anywhere, and I will carry my grandchildren. That's it. So, out of my journey is how the foundation started, and I'm grateful for NSIA LUTH or Medserve LUTH Cancer Center for giving us the opportunity to do this. We also work with other centers as well. So this has been a partnership in the making, 2 years and counting. So I want to say I love you. You don't have to look like what you're going through. Wake up in the morning, speak to yourself. Wear that dress you want to wear. Travel to where you want to travel. Don't let people say, hey, you guys are going to chemo. See, I'm here. I left home. I don't want to share extra details so as to scare all of, because everybody's journey is different. Everybody's journey is different. I left my husband. I traveled. I came. Came to come and enjoy myself. Came to come and serve. It's all part of the healing and wholeness journey for me. Giving back, doing all that. So please wake up every day wanting to live. Wake up every day telling God, telling the universe, this thing will not know. It will not. I will beat it and pray for the scientists too to find a cure. Pray for the doctors here too that God will help them, and pray whatever they put in your body that it works for you. Yeah, and it will work. It will work. Thank you so much for your audience. We've got some beauty kits here for you. Do your face look good. Walk around. Wear your shoe. Eat what you feel like. Eat well. Sleep. Rest. Participate in your church or participate in your community. Don't let cancer determine how you live. If you don't take anything away from this, do not let cancer determine how you live, because it's easy for it to do that to you. People with high blood pressure are living their lives.
Yes, many.
Diabetics are living their life. So if you reduce it in your mind that you are no different from any other chronic diseases, trust me, it will have no power over you. If you reduce it that you are no different, if I don't, what I did is I was telling cancer, you are no different from headache. Don't stress my life. If I want a different car, you are no different from headache. Don't stress my life. Don't stress my life. And so I didn't shut down my restaurant. Yes, I didn't go there every day. I had workers, I made room to rest, but I was not going to let cancer determine how I lived. I wasn't. The restaurant is still alive. We're still working. We're still growing. We're still expanding. So I did not allow cancer to determine the outcomes for me. I did not allow cancer to determine my marriage. I did not allow it to determine my service to God. I did not. No, I will not allow it. So refuse to allow it to determine how you live. So that's all I have for you.
Thank you.
And I just
Thank you.